So, warm welcome to the climate change and health session today, the first one of three actually. And thank you for joining despite Dr. Tedros, the Director General of WHO, speaking in parallel, as well as Margaret Chan, the previous Director General of WHO. Very happy to welcome you here. My name is Sabine Gabrisch. I'm a professor for climate change and health at Charité and based at the Potsdam Institute for Climate Impact Research. And I'm chairing this session together with Sir Andy Haynes, Professor of Environmental Change and Public Health at the London School of Hygiene and Tropical Medicine, who maybe many of you will know because he's been a driving force in the field of climate change and health over the last decade or so. Also, last year, we had a session on climate change and health at the World Health Summit, and that was after the largest global climate demonstrations ever in September 2019. And if you think about it, how much the world has changed due to COVID-19 since. And the COVID pandemic can be seen as one manifestation of the multidimensional planetary crisis, including also climate change and biodiversity loss. And that has to do with humans exploiting nature, mistreating animals, and abusing the atmosphere and oceans as a garbage dump. But the COVID pandemic also made us experience how connected everything is on this planet and how vulnerable we are as humans and as societies, as well as the importance of science and of good leadership. There's lots of lessons to learn from dealing with the COVID emergency that maybe can also be applied to dealing with the climate emergency, and we can discuss that later. My hope in a way is that the crisis could be some kind of wake-up call to realize that we are one part of this unique living planet, which we're pushing out of balance, and that it makes us reevaluate our priorities. So what is really important to us, and use this crisis to build back better for a green and healthy recovery. And the voice of health professionals is now even more important. We've had an incredibly dynamic development in Germany. The Health for Future movement started 1 year ago, and it's now active in 52 cities all over Germany. We had a Planetary Health online academy with 9 seminars from May to July that was attended by over 4,000 health professionals and students. Also this month, a suggestion for a planetary health pledge has been published in The Lancet, an update of the Hippocratic Oath and Declaration of Geneva, as the planetary foundations for health are being undermined in the Anthropocene, reflecting the special responsibility of health professionals. And we'll get back to that in the end. But first now, Andy will give a bit of background for all those who may be not as familiar with the current situation. So over to you, Andy.
Well, thanks so much, Sabina, for your introduction. I wanted just to say a few words about climate change and health for those of you, as Sabina said, who may not be very much engaged in this field. And I want to very briefly make the case that climate change is a health emergency, not just an environmental emergency. And by reframing it as a health emergency, and by emphasizing the benefits that occur when we decarbonize the economy, we can help to mobilize public opinion and help to increase the incentives and the ambition for action. Can I have the next slide, please? So many of you will have seen this slide before. It's taken from the IPCC special report on global warming of 1.5 degrees. But what it does, I think, very clearly is to show you how, as temperatures increase, the risks also increase. So threatened ecosystems, for example, the dark red shows you how the threats to those ecosystems escalate with temperature. And let me remind you that at the moment we're just over 1 degree, but unfortunately we're heading very rapidly to 1.5 degrees. And it seems very unlikely we can avoid reaching that point. But it's absolutely crucial, of course, that we do keep well below 2 degrees as envisaged in the Paris Agreement. And one of the reasons for that, or probably the primary reason for that, is because the risks, certainly as far as we know at the moment, escalate the closer we get to 2 degrees and as we go over 2 degrees. And the risks of extreme weather events, large-scale singular events like ice sheet collapsing, for example. Coral reef die-off is already happening. The Arctic region, it seems particularly vulnerable, is seeing particularly rapid climate change. Coastal flooding threatens many millions in coastal regions. River flooding also. And many of these impacts have direct or indirect effects on human health. So flooding is obvious, crop yields declining in parts of the world, direct effects of heat-related morbidity and mortality. The next slide, please. So this just summarizes some of the complex pathways, and I won't go into great detail about these, but the complex pathways by which the increasing levels of carbon dioxide, the most important greenhouse gas, but not the only one, which stays up in the atmosphere for a long time, perhaps 15% or more for 1,000 years or more. And then these short-lived climate pollutants like methane and others. And together, of course, they're what's driving climate change and causing increasing temperature, rising sea levels, and increasing extreme weather events. And the way in which they affect health is also mediated through a range of demographic, socioeconomic, and other factors, because climate change isn't occurring in isolation, it's also occurring against a background of a multiplicity of environmental changes, as really summarized in the concept of the Anthropocene, in which the epoch in which we're now living, in which these environmental changes are being driven by the activities of our species, of humans. So these are the exposure pathways at the bottom of the slide. As I say, I won't read them all out, but what you can see is there's a range of exposure pathways from the most direct, like heat stress and so on, extreme weather events, to the less direct, effects on water quantity and quality, food supply, vector distribution. And then on the right, these indirect effects, which are very difficult to quantify, but may well turn out to be amongst the most important. The effects on physical and mental health, for example, of displacement of population, increasing poverty, and possibly also increased conflict as well. So this combination of impacts, direct, intermediate, and socially mediated, really displays the complexity of the implications of human health, for human health of climate change, with really dire predictions as we go above 2 degrees and towards the end of the century, unless we take decisive action now. Next slide. So what can we do about climate change? Well, there are two broad policy responses. One is to adapt to climate change, and of course we do have to adapt. We do have to create more resilient health systems which can anticipate extreme events more effectively, or disease outbreaks, and respond to them effectively and efficiently. But adaptation will not be sufficient. We won't be able to adapt our way out of this crisis because some things cannot be adapted to. For example, if you're a subsistence farmer, you will not be able to adapt to increasing temperatures because they will force you to stop working in the hottest months of the year and push you back into poverty. So there are many things that we can't adapt to, and that's why we need to rapidly decarbonize the economy in order to avert dangerous climate change. But in doing so, there are a number of near-term benefits that we can reap those benefits from this rapid decarbonization process. So for example, our transport systems are currently inefficient and polluting, obviously major drivers of CO2. So that affects our health today in terms of air pollution, but also physical inactivity, because most of us don't take enough physical activity. And walking and cycling is about the only credible way in which you can get large numbers of the population actually doing so. Our energy systems likewise emit large amounts of air pollutants, but also carbon dioxide and other greenhouse gases. So for example, recent estimates suggest that 3.6 million deaths a year are directly attributable to the air pollution from burning fossil fuels. And if we stop burning fossil fuels, of course, then those premature deaths can be averted. And then finally, the food system, which is a very important driver of climate and other environmental changes, probably responsible for about 20% of climate change, if not more. And also, of course, is driving biodiversity loss, pollution, and so on. So our food system is dysfunctional. We have about 2 billion people, overweight, obese people around the world. At the same time, nearly a billion people, 800 million or so, are unable to eat sufficient nutritious food. In fact, many more if you include micronutrient deficiencies. So reforming the food system is a crucial objective, not just to improve health, but also to reduce the risks of climate change. Next slide, please. We're also realizing that the healthcare sector is quite a major contributor to emissions. So if the global healthcare sector was a country, it would be about the 5th largest emitter on the planet. And that means that we as health professionals need to get our own act in order and rapidly reduce the environmental footprint of our healthcare system. In some countries, it's much more than, it's about 5% of emissions. In some countries like the US, it's 10%. And so on the right side of this slide, you see where these emissions come from. The scope 1 are from the facilities, health facilities. Scope 2, the electricity that they purchase in. Scope 3 from all the supply chains that they depend on. So what that means is that as health professionals, we have a duty to work locally to try to decarbonize our health facilities, but also work with the supply chains by better procurement policies, which will incentivize the manufacturers to decarbonize their supply chains. So when they supply pharmaceuticals, medical devices, and so on, that they do so through decarbonized supply chains. And the NHS England, National Health Service England, has recently committed to net zero emissions by 2040 for the direct emissions and 2045 for indirect emissions. So we hope that will be the first of many national healthcare systems that will be committed to decarbonization. Final slide, please. So as we move towards COP26, delayed obviously by 1 year, there's this initiative called Race to Zero. This is comprised of 120 countries, over 1,000 businesses, 450 cities, large numbers of investors, and over 500 universities. This is the Race to Zero, the race to decarbonize our economy by 2050 at the latest, preferably much before that, but certainly at the latest. And this is an opportunity really for the healthcare professions to work together with colleagues across a whole range of sectors at different levels of governance to accelerate ambition, to accelerate progress towards zero carbon, healthy economy by mid-century at the latest. So I will stop there and I'll hand back to Sabine to introduce our first panelist. Thank you very much.
Thank you, Andy. And it's my pleasure now to introduce Niels Annen. He is Minister of State at Germany's Federal Foreign Office. And previous to that, he was spokesperson on foreign affairs of the Social Democrats parliamentary group in the German Bundestag. He holds a Master of International Public Policy from Johns Hopkins University. His main areas of interest are transatlantic relations and the Middle East, as well as China and Latin America. He is an advocate for a stronger German role in international diplomacy and supports multilateral engagement as a tool for solving today's conflicts and crises and protecting human rights. We've actually met almost exactly 1 year ago. On October 25th last year, just before the World Health Summit, then the Foreign Office hosted a wonderful one-day conference called One Planet, One Health, One Future, which was opened by Niels Annen, who also gave a talk about health and security in a changing climate and Germany's role, thus framing climate change as a health and a security issue. Andy and myself were also there and spoke on climate change and planetary health. And Christian Drosten spoke about viral emergence and various others. This event was very much on spot and even more so in hindsight with COVID-19. From this conference, the Berlin Principles on One Health emerged an update of the Manhattan Principles, and they were just published 2 weeks ago. And at that One Planet, One Health, One Future event, we also had a very interesting panel discussion where I made some statements on the insufficient political action on climate change also in Germany, which some people consider too bold. Maybe you remember, Mr. Annen. And you answered that we should continue to criticize you because politics needs that, or else it will react to other pressures. And so I'm very much looking forward to hear what you have to say today and to the discussion then. The floor is yours.
Well, thank you very much, ladies and gentlemen, and especially for that very kind introduction and reminding me a little bit about the entirely different political and day-to-day environment that we had a year ago. And I'm very happy that we can at least have that virtual exchange. I believe it has never been more important to bring together health experts, but also policymakers. In your kind introduction, I think you made clear that I showed some interest in health-related issues, but I'm not by any definition a health expert. But I think that's what it's all about, to bring different policymakers together, create a real network and an understanding. And that's also what I wanted to say in the brief period of time that you have designed or given to me for an introductory statement, because I want to make a reference to the United Nations and Secretary General Guterres, who qualified this crisis as maybe the most challenging that we have been facing in the 75 years since the founding of the United Nations. And Antonio Guterres also made very clear that it's not only a health emergency that we are seeing right now with the COVID-19, with this rising attention to these issues, it's a socio-economic crisis as well. And I also really deeply believe, and that's what also my experience over the last weeks and months was, how crucial it is to have stable and working relationship on the international level, multilateral institutions, to deal with threats to our collective health, but also prosperity and security. So there is an axis, and that is very important. I, with your permission, would like to make a reference to one of the initiatives that came out of the German Federal Foreign Office. Minister Maas, before COVID-19 struck all of us in April 2020, because of the ongoing pressure on the multilateral system, launched an alliance for multilateralism. And also in that alliance, and we are quite encouraged by the amount of countries that are supporting the agenda. One of the documents that has been supported by 24 foreign ministers made also a strong reference to our topic today. And I would just very briefly quote two aspects. They were agreeing to say that we need strong global cooperation and solidarity to fight COVID-19. And on the prevention challenge, it says, and I quote, in order to reduce the risk of future pandemics, we should promote the One Health approach as outlined by the World Health Organization. And at the same time, while we are speaking about COVID-19, Germany has been trying to put the entire question of climate change on the agenda of the Security Council. It may be to you as experts working on the issue since many, many years, sounds strange that there never has been a discussion between the nexus of security and climate change, although this seems to be one of the most obvious connections that are existing right now. And I can tell you that we saw a lot of resistance to that, including a threat of using the veto power by one of our most important friends and allies. So as a result, we don't have a resolution. But I think we kickstarted a debate that hopefully will continue also after Germany leaves the Security Council again at the end of the year. But the alliance that I had made reference to, the Alliance for Multilateralism, will continue to meet, also virtually, and also will continue to deal with health-related crises, but also to counter, and unfortunately, Sabine, if I may say so, this is also part of our daily work, to counter disinformation. I want to use that opportunity to talk briefly about one initiative, a so-called non-paper from the German and the French Foreign Ministry, which makes strong reference to the One Health approach as an interdisciplinary and cross-sectoral approach, based on the fact that human and animal health are linked to each other and to the health of the ecosystem. International Cooperation, though, seems essential also in this field in fighting the pandemic, but also in the reference to what we just heard in terms of climate change. And so to that, together with our French colleagues, we want to work on the One Health idea to strengthen existing structures and giving the topic more visibility in the political discussion, which is important to include decision makers, you know, all over the world virtually, but also in my country. Local politicians are assuming a very, very high responsibility right now in managing the crisis. We are all kind of becoming experts in virology and fighting the pandemic. So in that non-paper that I mentioned, we are laying out ideas how to strengthen and to enlarge tripartite cooperation between the World Health Organization, the FAO, and the OIE. The focus is clearly on the spillover from animals to humans. And the instrument of choice that I want to mention here in front of a group of experts is a One Health high-level council. Its aims would be to collect and to disseminate reliable and independent scientific information on the links between human, animal, and environmental health. We want to work, of course, with other governments, so with states, but also with international experts and civil society. And talks with organizations are ongoing with the aim to present the Council at the Alliance for Multilateralism at their next meeting in, I think, in November during the Paris Peace Forum. I also want to make a short reference because the Berlin principles have already been mentioned in the meeting that we had of the One Planet, One Health, One Future conference hosted by our ministry, the Federal Foreign Office, in October 2019 in Berlin, which will also serve as a point of reference, calling for unity of approach that is achievable only through convergence of human, domestic, animal, wildlife, plant, and environmental health. So I think there are many aspects that we need to link, that we need to bring together. And as I know that here also representative of a network of cities present, I also, as a member of parliament who has been elected from a district in a big city, my hometown, Hamburg has also been very active. Although I'm representing the federal level right now, I think that is really crucial. State politicians, mayors, etc., in many countries, and sometimes even in countries where the national level is ignoring climate change and its impacts, even in countries where sometimes top leaders are on the side of spreading fake news and denying the very existence of climate change. We are seeing that structures of societies and political decision making are often much more complex. And so, of course, we need to interact as a government with other governments, but there is no rule, no law that is preventing us from engaging with regional structures as well. And that's what we are doing. For example, working with a couple of governors, but also legislators in the United States who are very supportive when it comes to questions of climate change and supporting the Paris Accords, etc. So that's why it's not only a kind of courtesy to try to bring decision makers together in Berlin or right now in the virtual space, but it's really our conviction that this is the right approach. So I thank you very much for being here, and I'm looking forward to our discussion, and thanks again for the attention.
Well, many thanks, Minister. That was a great start, I think, to our panel discussion. And thank you so much for your reflections. It's now a great pleasure for me to introduce the next panelist, Rachel Huxley. Rachel Huxley is the Director of Knowledge and Learning at the C40 Cities Network. The C40 Cities Network brings together, of course, many of the world's most major cities, really working together to create a much more sustainable future. She's overseen the launch of the Knowledge Hub of the C40, which synthesizes evidence around more sustainable pathways for development. And she's led a program of research on the multiple benefits of decarbonisation, the zero carbon economy, particularly in the urban context. In the UK, she's developed the UK Sustainable Cities Network, which aims to share best practice between cities, because different cities, of course, have different strengths. They've worked in different ways, and many of those are complementary, and they can learn a lot from each other. She has a PhD in urban transformations and sustainable development. And in fact, she's also a collaborator of ours. We work together on a couple of Wellcome Trust funded projects, including the most recent of these, the Pathfinder initiative, which aims to find ways forward in the Anthropocene to rapidly decarbonize the economy and make use of the benefits and enjoy the benefits of decarbonisation. So Rachel, over to you, welcome.
Wonderful, thank you so much, Andy. And it's a real pleasure to be here today. As multiple people have said, sort of finding virtual ways to come together at this time, I think, is even more important than ever, and particularly on this topic around health and low carbon cities. And yeah, it was fantastic to hear the role of cities referenced just then, and I would completely concur. The leadership we see from cities, particularly those that occasionally are suffering against a national backdrop that is very unfavourable, is incredible and is very inspiring. So I'm going to talk about the work that C40 does on healthy low carbon cities. But before I do, I wanted to sort of mention why health is important for us as a climate organisation. And firstly, that's because it's a priority to our cities. So we're a network, as Andy said, of 97 of the world's mega cities. And as a network organisation, we respond to our cities' needs and priorities. And for our cities and our mayors and their citizens, health is absolutely a big priority. So we need to speak to that when we talk to them about climate change. Secondly, climate and health have common causes and they have common solutions. So it absolutely makes sense. We can and we absolutely should try and tackle these problems together. And lastly, health offers us a much more tangible, immediate, sort of personally experienced issue to engage people on. Climate change is often seen as more intangible and longer term, although, you know, I'm really caveating that heavily as we see climate change hit. This isn't something that's going to affect us in the future. People are being affected by it now. So increasingly, I think that will be less of a sort of challenge for us in getting climate change on the agenda, but certainly currently health is kind of perhaps a more tangible, immediate issue. So for those reasons, health is incredibly important for C40 as an organisation. So in talking about the work that C40 does on healthy low carbon cities, I want to speak mainly today about our benefits research programme, which Andy already referenced. So the benefits research is designed to make a much stronger case for climate change by demonstrating the wider social and economic benefits beyond GHG emissions reductions. We did some research that looked at what was stopping our cities being more ambitious and taking more ambitious climate action. And indeed, one of the things was making this case for climate change, and hence we set up that research programme. At a global level, we've undertaken some analysis to look at across our network what some of the benefits are, collective C40 city impacts and solutions. And that global level analysis is really about raising the issue of climate on the agenda, shaping and influencing that agenda. But what I want to talk more today about is how we've developed local tools and guidance. So those local tools and guidance are designed to enable cities to make a much stronger case for action for a particular policy or particular climate action that they want to take in their cities. How can they show that, as well as reducing GHG emissions, it will have a wider range of benefits? And the other thing that these tools and guidance do is actually help cities choose the most impactful action. If they're not sure between a range of policy choices, this can support them in better decision making or in understanding how best to implement a policy or an action. So the range of tools that we've developed now are sort of growing. We started with a walking and cycling tool, again referencing Andy's presentation at the start of this meeting, looking at how walking and cycling can help reduce GHG emissions, but also have a huge impact on health through increasing physical activity. We've developed a tool around air quality and understanding how a range of climate policies and actions can impact not just GHGs, but reduce PM2.5 concentrations, and how cities can show and demonstrate and quantify that reduction in PM2.5 and show the health benefits from that. We've developed a tool looking at retrofits and a range of benefits from retrofits, including avoided mortality associated with cold. And our most recent tool looks at heat health and how cities can improve health by mitigating extreme heat. And so what we do with those tools is we work with leading experts in the field to take cutting edge science and make that available to our cities, to transport planners, to urban planners, to other policymakers in our cities, so that they can use the latest evidence to be able to make a stronger case. And so we take that cutting edge science and we make it available in relatively simple tools and step-by-step guidance. We support cities to use those tools to build a case, and at the same time to build capacity within their cities to understand the linkages between health and climate and how they can kind of demonstrate those. So just to give a couple of examples to kind of make that come alive a little bit. We work with Lima. They were looking at some regulation they wanted to revise and tighten around charcoal stoves in restaurants. They have around 23,000 restaurants in Lima that use these charcoal ovens. And they had estimated that about 16% of their PM2.5 emissions were coming from this source. So a big problem for them, and also a large source of GHG emissions. So we worked with the team in Lima, supporting them to collect the right data, supporting them to undertake the analysis. And they looked at 3 scenarios for how they could tighten these regulations, focusing on just the larger restaurants, or the larger and medium restaurants, or larger, medium and small restaurants. And they were really able to see, okay, how could the difference in how they were thinking about implementing this policy impact PM2.5 concentrations, impact GHG reductions, and what would be the effect on the health of the local population. We were also able to look at cost savings for them in terms of fuel, because the upgraded stoves that we were suggesting would have been more fuel efficient. And so we were able to show the restaurant owners payback, which would have been between 1 and 6 years. So by delving into it, digging into this option more, we were able to show really there was a very good win-win for everyone. And we enabled the city to make a much stronger case for the policy in the first place, and secondly, to make a case for that policy to be more widely applied. Over the course of those months when we were working with the city, we really worked very closely with their team to enable them to understand the process. And through that really built the capacity of the team. And they've since used the air quality tool for further analysis of different policies and actions that they want to undertake. And they're now using the walking and cycling tool. So really understood the process and the principle of showing these wider benefits and making a stronger case. The second example I wanted to give was from Bangalore. We supported them to look at the benefits of increased walking and cycling. And it was around an action they were undertaking to improve road design, to prioritize space for walkers and cyclists and deprioritize space for cars. We helped them to understand the potential benefits from increasing cycling and walking. And we also, we did this support by bringing together a number of cities in Copenhagen to talk to them about good design, to showcase examples from Copenhagen about good walking and cycling, as well as bringing them together to teach them how to use the walking and cycling tool. And in that process, Bangalore, the staff from Bangalore were inspired enormously by the bike share scheme, amongst other policies in Copenhagen. And when they returned to Bangalore, they immediately committed to launching one of their own, which they then did in March 2019. So again, through engaging cities, through bringing them together to share ideas, we're seeing how we can accelerate action. So all the details of both of those examples and other examples can be found on the C40 Knowledge Hub. I don't have time, unfortunately, to go into huge detail today, but it's all up there. And as I said, the benefits program is the main work I wanted to talk about, but I'll just mention a couple of other things quickly. That is to say, firstly, as a network of mayors, one of the things that we do is really encourage leadership and setting targets and commitments. And one aspect of this is our declarations program. And here cities commit and set targets and develop an action plan and commit to reporting progress publicly. And so a couple of the declarations are really relevant to both health and climate. The Green and Healthy Streets Declaration, which looks at electric buses and zero emission zones, and the Clean Air Cities Declaration, which looks at cities committing to targets that meet or exceed national targets. So really good programming of sort of mayoral leadership and commitment there. And lastly, most recently, we've done some work around a green and just recovery. Of course, everyone's referenced the current COVID context we find ourselves in. And we had a request from our mayors to develop a task force to look at how we could support C40 cities to deal with the immediate crisis, but then also to think about how to recover from COVID-19. And we put together as part of this an agenda for a green and just recovery. And that was published in July. We've been undertaking work, research work very rapidly since to look at the wider benefits that a green and just recovery could deliver, looking at GHG, of course, but also jobs, given the economic context, and importantly, health. And that will be published on Wednesday. But really what we're seeing there from the mayors is an absolute awareness and really strong commitment to health and climate and equity as an agenda that needs to be at the sort of maintained coming out of COVID. I'll stop there. Thank you very much.
Thank you, Rachel. Now we should have had Jenny Miller speak, the Executive Director of the Global Climate and Health Alliance. But climate change came in her way in the form of wildfires in California, where she had to be evacuated from her home in Berkeley yesterday. Very spontaneously, Dr. Martin Herrmann agreed to step in for her. He is the chairman of the German Alliance for Climate Change and Health, in short, KLUK, a member organization of the Global Alliance that Jenny heads. KLUK has been founded almost exactly 3 years ago here in Berlin. And that was when I met Martin for the first time. And he's been leading the network from success to success and deserves a lot of the credit for the dynamic development in Germany that I mentioned at the start. Martin is a medical doctor by training, but worked most of his life as a consultant for change processes in businesses and international organizations. And that's a skill that's very useful now for enabling transformative changes to deal with the climate crisis. He's also a big fan of Hannah Arendt's philosophy. Thank you so much, Martin, for stepping in to represent the voice of the health community and talk about its role in tackling climate change. Over to you.
Sabine, thank you very much for the introduction. Thank you for all the speakers for having clarified kind of how important the connection between climate and health is, and how health and security can really be a framing for moving forward that is much stronger than the environmental framings that we have used so far. Because it is clear now in the COVID crisis that health touches us deeply. It's the #1 value of most people. When you have New Year's resolutions or birthdays, it's what we wish each other is first and foremost health. So thank you very much for having the chance to talk. Also, it is a very sad reason that I'm now jumping in, because we need to be in our minds and also with our hearts close to all the people in places in the world where climate change is kind of tackling us now, where it's killing people. It's very clear it is happening now, and it's really, really sad that Jenny cannot talk. And if I imagine myself, I'm living in Munich, close to a forest, there would be fires there and my house is in danger and my family is in danger, that's really, really disturbing. So as you have mentioned, 3 years ago, we were coming together, 5 medical students, 5 pensioners from health professions, and 5 kind of in the middle of their professional careers, and you were one of them, to found Klug. Because at that time, 3 years ago, the connection between climate change and health was not present in the German health sector, except for very few niches. So it was not a topic in medical schools, it was not a topic in medical association congresses or meetings, it was not a topic of the health minister of the German countries. It just was ignored. And we became together, we discussed it, and we felt we want to change this. This was kind of our reason to come together. And I think even in the early discussion, we felt we have to not only do it through the medical associations, but we have to found a network of actors, a network of change agents who makes this their #1 priority to spread the message. And out of an ethical imperative, we have understand the case. So now we cannot just live on like before, because this is not a normal case. We are talking about the threat that kind of the habitability of the earth is destroyed. And of course, this has huge ramifications for health, because if our platform is destroyed, we are destroyed. And that's what we are seeing with Jenny and other places in the world. So the key idea of Klug is to build a stronger and stronger network of actors, of change agents who are health professionals who spread the news. And that's what we have been doing in the last 3 years. But it's really, really important to understand that even in Germany, even with Friday for Future kind of actors, and with many other, with politicians, with mayors, the connection between health and climate is not yet understood. There's a lot of work of kind of education to city mayors, to doctors, to nurses, to politicians of all kinds, to make clear this is a key connection. And that from there, if you have a medical diagnosis as a health emergency of a planetary scale, it means in action we need to be much more courageous than we have ever been before. Because it's a key thing, we all know that it's not enough to have the knowledge, you have the diagnosis, you have to move into action. But the kind of action we are looking at is not normal action. It's not something you can control. It's really stepping into the middle of a storm and saying we have to change things dramatically. Because if you understand the severity of the diagnosis, severe therapy is needed, which means everything has to be questioned. All the things have to be questioned. It has to be a #1 priority, because it's about the life of our generation, it's the life of my kids and my grandchildren. So it's really, really important that we understand the severity of what we are talking about. And once we understand that as health professionals, it's clear we have to act. Because with the Hippocratic Oath, and now if you look at kind of the extension of this with the kind of planetary health, it is clear we have to act. It's a #1 thing. And that's what we are trying to do in Germany and also in other places, is to really spread the message. Because it is clear, if we as medical doctors, if we as nurses, if health professionals spread the word, if we talk to our patients, if we talk to politicians on a city level, it has a very different effect than if it's just happening to another resolution by a global organization. So Mr. Anand was talking about Hamburg. So in Hamburg, if more and more citizens and more doctors are talking about it and making it a #1 priority, it will be much easier for the mayor to do the kind of necessary transformative actions that are required. I think Rachel was referring to that. That's also why we are saying, as players, the ones who are kind of members in the Health for Future network, it is really important that you find where is your most strategic access point. And oftentimes it's within your city, it's within your county, or it is also when you are kind of working in a hospital. So we have now the first hospital in Germany who will have a kickoff to be a zero-emission hospital by 2030. It's going to happen early November. This is in Berlin, but it will happen in many other places. So it's really important not to wait for the medical association or for the health minister to do their work, but to do our work and be partners as doctors, as citizens who are requiring them and informing them on what needs to happen. So I think it's really, really important that we understand We have to spread the news, we have to make clear on an educational level what it is about, but then we have to have education for transformative actions. And we as doctors and nurses and health professionals need to understand ourselves as change agent. And it is very, very important. All big changes historically have been done by a minority of change agents who understand the case and spread the word. So I think that's the main thing that is needed, and also works that C40 is doing and that Minister of External Affairs is doing can get supported by us, because the drive to get the action into our populations cannot come from politics alone, because politics is not something that is happening in parliament. It's something when citizens come together to make the most serious things their own thing and start thinking about it and acting about it. And that is what Hannah Arendt was teaching us, from discussing and in investigating in how can it happen that something like totalitarianism and fascism is even possible. So the only antidote, the only vaccination against it is human actors getting together, making sense with each other, and having the courage to act into the open and to learn with each other, because we need many, many experiments, and we need to fail forward. We need to have the courage to do things that fails and learn fast, and then do the next thing to work out. So thank you very much again for the invitation. I'm very happy to be part of this panel.
Martin, thank you so much for stepping in so effectively when Jenny couldn't make it. I think you've made so many important points, and just worth emphasizing that if you look at the opinion polls globally, the most trusted professions, nursing comes out top.
Yeah. And perhaps one thing to add, so it is very, we all know that the reputation of health professional is the highest. And perhaps the second thing, it's really also, we're doing some work, and Andy, you do it also with the Global South. We need to understand that also in the Global South, the connection between climate change and health and biodiversity loss and health is not yet made. So it needs to be a major program. We're doing now a small program supported by DAT in East Africa to found a East African Planetary Health Hub. Things like this need also to be very much in the foreground of our mind, because over there, the things have not yet been understood. So it's really important that we work locally, but also are connected and support each other on a global level.
Absolutely, and we're seeing now a groundswell of interest from our colleagues in Africa, for example, in this whole concept of planetary health, climate change and health. And so there is really a burgeoning movement, particularly amongst our early career colleagues in Africa and other parts of the world. But it's a great pleasure for me to introduce our final speaker, because actually Carlos Nobre also works in a very vulnerable part of the world. He's a very eminent Earth system scientist with a PhD in meteorology, currently with the University of Sao Paulo. He's had a career in Amazonian and climate science, so he was very much involved with the National Institute of Amazonian Research in Brazil and the National Institute of Space Research. He's won many, many prizes, including the Volvo Environment Prize, the von Humboldt Medal, and so on. And he's really made seminal contributions to our understanding of how the Amazon regulates the climate, the environmental threats to the Amazon. And also, I think, resonates very well with the point that Martin was making about the growing awareness of the links between climate and environmental integrity in many parts of the world. So, Carlos, welcome, and over to you.
Good morning to all. Thank you very much, Andrew. And I'm a Earth system scientist, mostly related to the Amazon and also climate. I'm not a health scientist, but I will talk about the Amazon and perhaps some implications for health. What's going on right now? We are really very concerned seeing a rise in deforestation, a rise in forest fires in the Amazon. Unlike California or Australia, fires in the Amazon are 99% human caused, human set fire. Very few fires are ignited by lightning. So, of course, we do not know exactly what the consequence of those destructive ways of developing the tropics. So And also, of course, COVID-19 brings in this additional concern. Transmission rates in the Amazon were very high, including affecting indigenous populations. And still, science does not know whether the indigenous population of the Amazon, they are more vulnerable to this particular virus than the other people in the Amazon. So we are very concerned because we can see the Amazon is really very, very close to a tipping point of losing most of the forest we call savannization. Most of the Amazon forest will turn into a degraded tropical savanna with tremendous consequences. And that tipping point has already been activated. We know that as a fact, observing what's going on. And this is a very complex synergistic interactions between global climate change related to the warming of the North Atlantic, the tropical North Atlantic. And this is linked to global planetary scale interactions between the ocean and the atmosphere. The so-called thermal highline circulations, they are becoming weaker, so they are warming up the tropical North Atlantic. That warming up induces more droughts in the Amazon, overall reduction of rainfall. And this synergistically interacts with the local influence of deforestation. So this synergistic interaction is really showing up very clearly now. For instance, what we are seeing in the last decades, we are seeing increase in the occurrence of extreme droughts and also floods. So extreme events are happening more frequently, and this is global phenomena due to global warming, but this is enhanced in the Amazon due to regional deforestation. Hot spells as well. Very concerning is the dry season is becoming longer, 3 to 4 weeks over the forest regions, mostly 4 weeks. So the onset of the rainy season in southern Amazon is delayed by 3 to 4 weeks. If the rainy season, if the dry season becomes longer than 4 months, this is a typical savanna-like climate. We are seeing also less water recycling in southern Amazon. The forest is recycling much less water. This is a very clear aspect of tropical forests, very efficient recycling water. Also, observations show a reduction of the carbon sink strength. There are some projections that before 2030, the Amazon will stop being also a carbon sink. And we are seeing higher mortality rate of wet climate tree species in southern Amazon. And the recent paper 2 weeks ago showed also a savannization of fauna. The typical fauna of tropical savannas are becoming more common in southern Amazon. So basically, in summary, we can say this, if deforestation rates exceed 20-25% of the forest, we are at 17% now. It's very likely it will be, the tipping point will be exceeded, and that a process of savannization will start. It has started in southern Amazon, and it will be unstoppable, irreversible. Between 30 and 50 years, the whole Amazon will become, not the whole, 60 to 70%, except the Western Amazon near the Andes, which is very wet, that the forest will still remain there. So this is what we are saying and we are seeing in the observations. What climate consequences that savannization might have? This is emissions of 300 billion tons of CO2 into the atmosphere, so almost making it impossible to reach the 1.5 degrees. The carbon space is 400 billion tons. Only the Amazon will emit 300 billion tons if there is desalinization. 2 degrees additional warming to the global warming. The forest cools the climate. Longer dry seasons and more frequent climate extremes. And also losing the climate stabilization towards other parts of South America, this moisture transports from other parts to other parts of South America. For instance, in southeastern South America, something like 20% of the rain comes from this moisture transports of the Amazon. So what might be health consequences? And I warn, I'm not a health scientist, but just generally speaking, we may say 2-3 additional degrees in warming on the top of global warming, because as I mentioned, the forests cool the climate, and without the forest, with the savanna, the Amazon will be 2 to 3 degrees warmer, and actually the maximum temperature might be even between 2 and 4 degrees warmer. So certainly the first issue, very clear, is the physiological limits to humans. The wet bulb temperature will be exceeded perhaps 20 to 30 years earlier than it would happen only with scenarios of global warming. So this is a very troubling aspect. Another one, of course, is the increase in fire-related pollution diseases. We are seeing that at this time of the year, August, September, and October, the pollution, PM 2.5 and CO pollution is one of the highest in the world, affecting 1 to 2 million square kilometers, affecting over 30 million people. So this is another health impact. And of course, because of COVID, we all pay attention now to the risk of microorganism spillovers. One may say the forest may not disappear without first its legions of viruses, bacteria, parasites, and fungi make themselves heard. It's a little bit of a mystery, science mystery, but I'm sure science will evolve and we will be able to understand this puzzle that intrigue a lot of experts, why the region, the Amazon, has not yet produced a pandemic disease, a pandemic. There are identified perhaps 8 to 10 viruses which have caused limited, regionally limited epidemics, which have gone, emerge and then go away. The Amazon is the richest place for arboviruses, and still why, and we are disturbing the Amazon with fires. So perhaps one possible explanation is the Amazon is the place with the largest biodiversity on Earth, and perhaps the biodiversity helps to maintain this equilibrium, this balance in which the microorganisms are contained. But still, this is a mystery, but we are disturbing. And if desalinization takes place, then it becomes very difficult to predict what would be the spillover of, perhaps hundreds of thousands of viruses that may exist in the Amazon. So I will stop here, just raising this issue that spillover of microorganisms from the Amazon is something that we really have to be very careful, and to restore the ecological balance globally speaking, but in particular in the Amazon, is essential to prevent desalinization and also to increase the risk, to reduce the risk to health. Thank you.
Thank you. Thank you very much. Sabina, do you want to? Thank you very much, Carlos. A great talk, and I think that will stimulate some discussion and questions. Sabina, do you want to start the Q&A?
And maybe to encourage participants, you can add your question in this question box, and then we'll pick up some of them as we manage. Yeah, maybe let's start with one on the health sector in particular. And there are two questions on the nurses' climate challenge and the critical role of nurses, and people asking more information on that, and adding that there will also be one in Europe. And maybe in link with that, Omnia El-Omrani asked, like that, seeing that NHS and German hospitals commit to zero carbon, and coming from Egypt, how can they advocate there as medical students and young professionals to push hospitals to commit to such a transition, or in general in low and middle income countries? And maybe linking to that as well, another question where they said the growth in health, from Ben Kenny, the growth in healthcare expenditure has become uneconomic, where additional expenditure doesn't lead to an increased benefit. So how can we use these economic arguments to strengthen the debate surrounding the obvious moral and existential threats of climate change to health? Like putting that bundle maybe together there for.
Maybe Martin wants to.
Maybe Martin to start, I don't know.
Yeah, I mean, to Omnia's question, I mean, in our own experience, you start not by starting with zero emission hospitals, but by building a network of health professionals who understand the broader topics, and then depending on where they are located, start with the things where they can be most effective to start with. So the first thing is really to build a network of health professionals who understand the full context, and from there then see where could this strategically start moving. And in our own history, we have started 3 years ago. It was clear from the beginning that the footprint of the health sector is a key aspect, but it took us some time to really understand how to leverage this. So this is now the time where we talk about zero emission hospitals, where we work together with Nick Watts from the NHS, where we really see how to get the action kind of in a broad sense, because it requires then also to talk to ministries to change financing streams and to create a larger awareness. So I would argue first start with building your network, and then see when you go to zero emission hospital agenda.
Maybe I can pick out a question from Ralph Królewski, who's asked a number of questions actually, but I wanted to pose one of them to Rachel, which is about the scope 3 emissions from cities. So scope 3 emissions are the kind of more consumption-based emissions, and they're the ones that are most difficult to control, I think it's fair to say. And Rachel, I wonder if you could comment on the issues here. Sometimes as you reduce the energy-related emissions, of course, the consumption emissions continue to rise because we still buy goods from all over the world. Can you say something about how you're trying to tackle those in C40?
Yeah, absolutely. It is quite correct to say that the consumption-based emissions are a real challenge. And particularly if we're considering developed countries and cities, where we're seeing some incredible progress on the scope 1 and 2 emissions, and really seeing cities meet the targets that we need to for those. But when we consider the full consumption-based emissions associated with some of the lifestyles that we're enjoying in those types of urban areas, then the challenge is still really very, very relevant. Particularly for cities, as a sort of urban areas, they have vast supply chains and produce a lot of emissions that are associated with consumption, not production, as you'd expect. So it's harder for our mayors, as I said before, we're a network of mayors, to influence that. But we are seeing, again, a huge amount of leadership, a huge amount of will and ambition to deal with that. So we've had a number of cities that have started thinking about that, even though you'd forgive them if they wanted not to, who very proactively started thinking about consumption-based emissions. And I would suggest that one of the best places to kind of look at for the work that we're doing on this is our Thriving Cities initiative. And that builds on some work around how we can create more sustainable cultures and lifestyles. So how we can meet the thresholds that we need to for social development without exceeding the very real thresholds of our planet and our environment. And that's based on some of the work by Kate Raworth on donut economics. And so we've been working with cities to look at social and economic aspects at a local and a global level and how they can think about that. The food system is obviously critical for that, and there's a huge overlap again with health and climate. So doing work with cities to try and understand their food systems and how they can influence those, both locally, work they can do locally, and how they can perhaps impact kind of culture and have an influence on the supply chain. And we're seeing very practical actions taken by cities around other things such as air travel, which again is kind of outside of scope generally. But yeah, so we're seeing proactiveness, we're seeing pockets of best practice, but I think consumption-based emissions still needs an awful lot of work to be brought kind of into the mainstream mechanisms of controlling GHG emissions, because by and large we report on and look at scope 1 and 2. And it's just very difficult for cities even to begin to understand what their scope 3 emissions are, never mind control them. But lots of hope out there, and I would suggest that anyone who's interested in finding out more goes and looks at the Thriving Cities Initiative work that we've been doing.
I mean, I would argue that this is a perfect example where health professionals potentially could play a catalytic role. And I think that's something that we need to inquire how we play that, because alone in Germany, we have 1 billion patient contacts a year. And if some of them are focused on, you know, kind of necessary lifestyle changes with regard to health, and you include the environmental argument, we might come to new ways of kind of addressing lifestyle changes together.
Yeah, I would completely agree with that. I think everything you sort of have said about how health professionals can influence, you know, individual awareness and attitudes and lifestyles and behaviors, I think is critical. Our mayors can't make the changes that they need to and they want to without a political mandate, without political support. And we don't get that until people really begin to understand, until there's a very strong kind of cultural change in the way that we think and the way that we behave. And that, you know, a huge part of that comes from the day-to-day conversations that we have, and particularly, again, as you've several people have pointed out, with trusted individuals and how important that is. But yeah, making this a sort of daily conversation, people hearing about it, not from the, you know, usual green quarters, I think is hugely important.
Maybe I'm going to take a question now from Remco van de Pas to Niels Annen. And he's asking, given the current German presidency of the EU, could you please comment on the common agricultural policy just adopted by the European Parliament? Many people are disappointed by its conservative approach and how difficult it will be to attain the objectives of the new Green Deal.
I was somehow being afraid of that question being asked. Look, I think that's just an example for how difficult these kind of implementation of broader goals that we all agreed on. Martin referred to some of the declarations and statements made by international organizations, but the hard proof is the question whether we are able to implement this or not. So speaking as a representative of the German government here right now is a little bit difficult, but as I'm also a directly elected member of the German Bundestag, I think I mentioned that from Germany's second biggest city, I can say that on a personal note, I am disappointed about that result, although I'm not surprised. Because if you look at the history of the European Union, the field of agricultural politics has always been the real heavy lift. And speaking about the majority of the population also in Germany that lives in metropolitan areas and big cities, this is often not in the center of the discussion. I understand that there is a lot of debate ongoing right now, also in the European Parliament. And for the German government, it is the challenge right now to bring everybody together. So what we are seeing with the common agricultural policy is also happening in other fields. For example, the question of rule of law and separation of powers. So I think we need to accept a certain amount of criticism, which every chair would need to accept, regardless of being at the presidency of the European Union or maybe the chair of a big medical company or hospital. So, so I think that's right now what I can say. But it's also with the agricultural policy true what is true for all the aspects that we touched upon in this discussion. In a democratic system, if we want to change things, fundamentally, we need to have majorities. And so I'm certainly not happy with the current outcome, but I also want to use that opportunity to say that I deeply believe that we can only achieve sustainable progress by democratic means. And that means that this is a tough and a hard way that lies ahead of us. And we need the pressure from civil society, from national parliaments, and from the experts involved. And that is also true for that question. And I'm quite certain that this is not going to be the end of the story.
Thank you very much. Great response. Martin, did you want to come in briefly? I just want to say also that I think food and agriculture.
Just very briefly, I think that's a perfect example where we as health professionals can play a catalytic role, because also with many politicians I've talked to, they have not yet understood the connection with climate change and health. And if they understand it's a rising issue with all the medical association, it's coming as a top priority. And medical professions, and especially doctors, are usually seen as conservative. This can be a game changer. So it's really important that we as health professionals play this educative role and this advocacy role to politicians, but also then to the broader citizens, so that they influence with this conversation their politicians. Because once they will understand that this is a rising issue and it will never go away again, they will start looking at things differently, especially with regard to nutrition and other topics. So I think it's a perfect underlining of just what you said.
Yeah, absolutely. And let me turn to Carlos now, Carlos Nobre, because there have been a couple of questions about the Amazon and about the importance of raising the kind of international profile of the impacts of what's happening in the Amazon, how it will affect the whole world. But of course, some of those changes are driven partly by demands for animal products. It's partly related to changes in the food system, deforestation for cattle ranching and so on. So do you see a prospect, Carlos, and would it be helpful for the health community in Brazil and more generally to be working with people like yourself to make the health argument about not just the dangers of pollution and the dangers of climate change, but also about more sustainable food systems and how they relate to individual and planetary health?
Yes, absolutely. I think this is very important. We have seen since 2019 more concern in general, particularly from European countries, on deforestation-free supply chains. We are seeing implementation of those policy investment funds now are demanding deforestation-free supply chains, particularly the meat supply chain. So I think this is, and that's interesting because of this concern coming from abroad, finally, Brazilians are much more concerned about diets, about food. So I hope, yes, health professionals in Amazonian countries, 76% of the meat produced in the Amazon is consumed in Brazil, so it's not exported. So it would be very important really to move in that direction. Brazil has these two very opposed type of people in Brazil. Brazil is the second country with the largest percent of vegetarians and vegans after India, but also is the third country in animal protein per capita consumption. So there's these two communities exist in Brazil. But I think, now with this overall global movement towards deforestation-free supply chains, which was initiated by Europe, but now it's becoming, even in China, China now is demanding that in importing soy for animal feed. So we are hopeful that, in Brazil also, that will become more dominant type of policy, and particularly for health professionals, because as you people know very well, in health issues related to obesity and things like that are raising very fast in Brazil, and that has to do with the diets. So it would be very important really for health professionals in Brazil to engage themselves more directly with changing diets. Yes.
Thank you, Carlos. Sabina, do you want to ask the next question?
Sure. As a question from Andrew Farlow from Oxford, and he was struck by Niels Annen's comment on that everybody's becoming experts on the biology of coronavirus, and everybody talking about R numbers, and that people have sort of understood the exponential nature of the epidemic, and that even an R number slightly above 1 is gonna lead to big trouble quickly. And then he's wondering, and this is kind of to everybody, I think, nearly, is like, what is the equivalent of the R numbers in this space for climate? Like our arguments in terms of temperature, degree rise, and so don't seem to get through that much. And Carlos talked about the tipping point in the Amazon. We know about tipping points in Greenland, etc. Andrew mentioned in the beginning. And how can we kind of get it better across? Oops, now I lost it. That people can see this epidemic danger that's happening from climate change. And can we have some kind of R for permafrost and for tropical forests, or to show this like sensitivity of the system, and that people understand these exponential processes are getting out of control? Maybe something we can learn from the pandemic.
Well, I first of all, I appreciate the question, and I would leave it a little bit with the experts, but I do think that we have global points of reference. The IPCC has been mentioned. We have a global set of policy goals when it comes to global warming. But I mean, it's true. The experience also that we made in the last difficult month with COVID-19, and maybe not that much as a surprise, is that when, as a result of that pandemic, people are afraid about their health and the situation of their relatives, but are also suffering because of economic consequences. So the socioeconomic aspect that also Antonio Guterres was referring to, and the quote that I used in the beginning of my introduction, I think makes clear that in addressing both the climate issue but also the pandemic, we need to be aware of the social impacts of policy. And we cannot leave people or exclude people from our discourse, even if they are maybe opposed to our policies. I think that is something that we can clearly see if politicians do not address the concerns of the affected population by some of the tough measures that we need to take in order to fight climate change. Because, for example, of fear of losing their jobs or security and their traditional environment in some of the affected industries, then we can lose it all, because this can change political majorities. We're seeing this not only in a country like the United States. we have a party in the German parliament right now, not a majority party, but the AfD party, where the majority is in the camp of climate ignorance and spreading fake news, etc. So I think also what Martin Herman said in his last input, it's very important that it's not only, you know, politicians and public figures, but we need to have the legitimacy, with the credibility in order to make the argument. And I certainly believe that also with the prestige that the health sector in general, but doctors in particular, at least in Germany, are enjoying, this really can make that really can make a difference. And I feel also a little encouraged by our approach that we laid out in the joint German-French non-paper that I mentioned, that we really need to somehow maybe even more also institutionalize the debate to make clear that there's connects between climate change, security, and health, and that this is not a theoretical debate by scientists or by politicians, but that this has a very clear and also local impact on everyday, on our everyday life. And I believe that this is an argument that we can make, and we should use kind of fora like this to exchange views, experience, and it needs to be an argument that also addresses the living conditions of the population, which differs. In more poorer countries, you need to have another way to address people, to include them. In a more developed society like Germany, we need to find our own way. But this is doable.
Thank you. And I think we'll actually nearly use this as the final start of the final round of statements to wrap it up. And I'd like to go to Carlos Nobre again. And actually someone also commented to thank you explicitly for getting up at 4 or 5 a.m. for this panel. And like maybe something you want to say about this, how can we better get the tipping points across? As far as I know, in the IPCC, that was also a question that they're not really explicitly included yet, but yeah, and maybe
Sabrina,
also
can I just say that we have very little time left and we want to show the video. So if I could encourage people to respond with sort of 1 minute, then it will give us time to show a brief video at the end. Thank you.
Yeah, very briefly. I think, you know, climate, we have to be effective to communicate the risks as people from health are. For instance, all of the planet now expects the vaccines to work for COVID. So it's like, you know, we have a problem, the science, the medical science, the health science, you find solutions, and then the problem is over. Unfortunately for climate, there is no way to find a quick solution that, let's say, in 2-3 years, we'll get rid of this virus, this pandemic. So how to communicate? You people from health, you know how to communicate risks. We from climate, we do not, or we're lacking the way, you know, a molecule of CO2 remains 150 years in the atmosphere. How to communicate that this risk is not going to go away next year, in 3 years. So we are not effective. I'm not saying it's only climate scientists. I'm saying globally, we are not effective in communicating the risks of climate change.
Shall we turn to Rachel to make a brief statement?
Yeah, thank you. Just been really interesting to be part of this discussion. I'd agree completely with the comments that have been made about communicating. I think with climate science, it's very complex. That's part of the difficulty, but I also agree that we just haven't been as effective as at communicating. And how do we make it real? Talking about what the actual, you know, social and economic impacts are going to be, what are the immediate, tangible, direct, experienced impacts on people's lives. I think the R number links very clearly to our daily lives. It has an immediate direct impact on that. And when we can do the same with climate change, which is happening now, it's not something that's going to impact in the future, but we need to be more effective about kind of making that direct link. And I just think with post-COVID, it really is the last window of opportunity for us to keep climate heating to below 1.5 degrees. The 15 trillion that's going, 12 to 15 trillion stimulus funding would be enough to fund what people have estimated is required for for the climate change that we need. And if we use that stimulus to fund a green and just recovery, then we can really get ourselves on track for 1.5 degrees. But at the moment, it seems that the vast majority of that money is not going towards that. So we're basically squandering, we're on the poised to squander the last opportunity we have really to make that happen. So I think a sense of urgency about how quickly we need to kind of change things is probably my last point.
Maybe just to add that we shouldn't forget the commercial interests behind it as well. If we blame ourselves for communicating badly, there's also deliberate misinformation with a lot of money behind it. And we can learn from tobacco industry how this delayed action for really, really long. Anyway, but handing over to Martin for a last statement.
Just 2-3 sentences. I really think it's important that we are clear. We have a very good story to tell. It's about good and healthy life in cities. We understand the urgency, but then life is not going to be miserable. It can be great and we can learn. So we really just need to be courageous to act upon the things that we need to act upon. And it can be a network of great players doing that. So being part of this transformative network is a great pleasure. You meet great people. So let's just jump and do the work that is needed.
Thank you so much, Martin. And let's give the last word to Niels Anand then to just give us his summary views.
No, thank you. Thank you very much. And as we are under time pressure, and I understood that Sabine already took my last statement as a closing statement. And so I think I basically can leave it with that. I again want just to repeat that we feel encouraged to be part of that discussion. That also has not always been the case for the Federal Foreign Office. And I believe that the more we can include decision makers, politicians, not only the experts, but those that we need to bring the message to the people and to create the political legitimacy that we need, the better we are off. And so I understand that there's sometimes not enough, no more patience, and I don't want to urge you to be patient, all the contrary. But I just want to say also, because what Rachel mentioned, the number of funds that are now made available to stabilize our economies after COVID-19, we should not forget that that this is also an investment in the democratic stability of societies, which we need also to convince people to change part of their lifestyle and to support the policies that we maybe know that it will be necessary to reach our global goals. So thank you very much, and it was really a pleasure to join you from here.
Well, thank you so much for all our panelists. We've had a wonderful discussion. And I'd like to thank everyone and obviously send our best wishes to Jenny Miller in California. Sabina, I think we're hoping we might just see perhaps not the whole video, but maybe a minute or so of the video. Do you just want to briefly introduce it as we close the session? But thank you all very much.
This is what I mentioned at the very beginning, this planetary health pledge for health professionals in the Anthropocene, updating the Hippocratic Oath in a way. And Laila, I don't know if we can still squeeze it in to show it now. And it's from the University of Minnesota School of Nursing, who were the first to record set by students and faculty.
I solemnly pledge to dedicate my life to the service of humanity and to the protection of natural systems on which human health depends.
The health of people, their communities, and the planet will be my first consideration, and I will maintain the utmost respect for human life, as well as reverence for the diversity of life on Earth.
I will practice my profession with conscience and dignity, and in accordance with good practice, taking into account planetary health values and principles.
To do no harm, I will respect the autonomy and dignity of all persons in adopting an approach to maintaining and creating health which focuses on prevention of harm to people and planet.
I will respect and honor the trust that is placed in me and leverage this trust to promote knowledge, values, and behaviors that support the health of humans and the planet.
I will actively strive to understand the impact that direct, unconscious, and structural bias may have on my patients, communities, and the planet, and for cultural self-awareness in my duty to serve.
I will advocate for equity and justice by actively addressing environmental, social, and structural determinants of health while protecting the natural systems that underpin a viable planet for future generations.
I will acknowledge and respect diverse sources of knowledge and knowing regarding individual, community, and planetary health, such as from indigenous traditional knowledge systems, while challenging attempts at spreading disinformation that can undermine planetary health.
I will share and expand my knowledge for the benefit of society and the planet. I will also actively promote transdisciplinary, inclusive action to achieve individual, community, and planetary health.
I will attend to my own health and well-being and abilities in order to provide care and serve the community to the highest standards.
I will strive to be a role model for my patients and society by embodying planetary health principles in my own life, acknowledging that this requires maintaining the vitality of our common home.
I will not use my knowledge to violate human rights and civil liberties, even under threat, recognizing that the human right to health necessitates maintaining planetary health.
I make these promises solemnly, freely, and upon my honor. By taking this pledge, I am committing to a vision of personal, community, and planetary health that will enable the diversity of life on our planet to thrive now and in the future.
Well, thank you everybody again for attending, and the panel members, but also the audience. I think it was also a very strong statement here now in the end, and I'm looking forward to working together with all of you to help achieve a more healthy human population on a healthy planet, because that's the biggest priority that we can work towards, and it's a positive goal. And I think if we all work together, it's still within the realm of possible. And as medical doctors, we don't give up. If there's still some hope for the patient, then we have to do the best we can. So thank you, and I'm looking forward to being in touch. Bye-bye.
Everyone.